During the past few months, the coronavirus pandemic has gripped the entire globe. It's killed thousands of innocent people and decimated world economies and family pocketbooks alike. For the first time in American history, a federal disaster has been declared for all 50 states. Almost 700,000 Americans have been infected with COVID-19. More than 35,000 of them have tragically lost their lives. Economic damage has hit even more Americans than the coronavirus itself. More than 22 million Americans have filed for unemployment. More than 1 million Texans have filed unemployment claims. Businesses have shuttered. Paychecks have disappeared. Food bank lines are swelling across Texas as more families seek food that they desperately need. Well, in typical Texas fashion, you have come together to support one another. You have made personal sacrifices to ensure that our state slows the spread of COVID-19. You helped to reduce the number of Texans who needed hospital care. You truly help to save lives. Now, Texas needs you to continue those efforts. But I want you to know that we are especially grateful for the doctors, the nurses, the first responders, and all medical personnel who have been battling on the front line against this invisible enemy. We're also thankful to the unsung heroes serving as child care staff, grocery clerks, food service providers, and the folks who clean our hospitals. And we're grateful for President Trump, Vice President Pence, and the entire Trump administration for being available to me and my fellow governors 24/7 throughout this entire pandemic. I also want to recognize the members of the Texas House and Texas Senate for their ongoing leadership in their districts. And I want to recognize all of our local leaders for their continued partnership as we collectively respond to the coronavirus in Texas. Because of the efforts by everyone to slow the spread, we're now beginning to see glimmers that the worst of COVID-19 may soon be behind us. The number of infections and hospitalizations is beginning to level off. We have a steady supply of PPE like face masks. We have plenty of hospital rooms and ventilators to treat our fellow Texans. And the deaths, while far too high, will not come close to the early dire predictions. And I'll add this: Texas has the second most recoveries from COVID-19 of all states in America. We have demonstrated that we can corral the coronavirus. We continue increasing our testing capabilities to help us identify and care for Texans who have COVID-19. New strategies are being used by private businesses and the public sector to contain the coronavirus. Things like checking temperature, distancing practices, and better sanitation standards. We've shown that we can both continue our efforts to contain the coronavirus while also adopting safe standards that will allow us to begin the process of reopening business in Texas. So today I'm issuing an executive order that outlines how we go about opening the Texas economy, helping you return to work using the safest standards to contain the coronavirus. Now, in opening Texas, we must be guided by data and by doctors. We must put health and safety first. We must prioritize protecting our most vulnerable populations. We will be getting input from medical professionals as well as business and community leaders to determine the safe and sure way to reopen business in Texas without spurring the spread of the coronavirus. To guide this effort, I have formed a statewide strike force to open Texas. The team includes Lieutenant Governor Dan Patrick, Speaker of the House Dennis Bonnen, Attorney General Ken Paxton, and Comptroller Glenn Hager. They are joined by a team of nationally recognized medical advisors who will inform us about the best healthcare standards to prevent the spread of COVID-19. Those advisors include the Commissioner for State Health Services, Dr. John Hellerstedt. They also include Dr. Mark McClellan. He served both as FDA Commissioner and Medicaid and Medicare Administrator for the United States of America. It also includes an infectious disease specialist and Director of Testing and Tracing of COVID-19 at the University of Texas Dell Medical School, Dr. Parker Hudson. And they include Dr. John Zerwas, the Executive Vice Chancellor for Health Affairs at the University of Texas System. They will work together to develop a medical architecture to comprehensively test and trace COVID-19 that will enable Texas to gradually and safely begin the process of returning to work and returning to other activities while we wait for the immunizations that will end the threat of COVID-19. Our medical team will work with an advisory committee of successful business and community leaders who will share information and innovative ideas to help businesses strategically reopen while also containing the spread of the coronavirus. They include entrepreneurs like Kendra Scott and Mattress Mac Jim McInville, world-renowned tech leaders like Michael Dell and Robert Smith, economic development leaders like Ross Perot and Bob Rowland, small business leaders like Arcelia Acosta and Massey Villarreal, economic experts like Richard Fisher, the former president and CEO of the Federal Reserve in Dallas, dining and entertainment trailblazers like Tillman Fertitta and Ballas Miller of Bill Miller's Restaurants in San Antonio, Texas. Nonprofit organizations, leaders like Nancy Kinder and Kirk Watson, the founding dean of the University of Houston Hobby School of Public Affairs. This team will collaborate with working groups to open up Texas while keeping our communities safe. They will be led by a chairman who has successfully run businesses and knows his way around the Capitol, James Huffines. He will preside over a full-time staff spearheaded by Mike Toomey, a proven chief operating officer who knows how to quickly deliver results. I want you to know that I've already begun working with this team about next steps for Texas. James Huffines and the full-time staff have been working around the clock, and the team of advisors has already finished their first meeting, and they have begun the process of making recommendations. As a result of our combined efforts, I am issuing executive orders today that will begin the process of opening Texas. Now understand this. Opening Texas must occur in stages. Obviously, not all businesses can open all at once on May the 1st. Some businesses, if fully open without better distancing standards, would be more likely to set us back rather than to propel us forward. A more strategic approach is required to ensure that we don't reopen only to have to shut down once again. First, will be openings announced today that include activities that should pose minimal or no threat to expanding COVID-19. Second, additional openings will be announced on April the 27th after further input from the advisors and the medical staff. Third, even more openings will be announced in May when it is determined that the infection rate continues to decline, that hospital capacity remains available, and when testing capacities are sufficient to detect and contain outbreaks of COVID-19. The first executive order today establishes the governor's strike force to open Texas. It sets out the organization and the duties of the strike force. They will gather information and make recommendations about ways that businesses can reopen, as well as the safe practices those businesses should use. My next executive order focuses on doctors, nurses, hospitals, and medical staff. Many doctors and nurses have been sidelined because of the need to postpone non-essential medical procedures. That was done to free up hospital capacity and the PPE needed to treat COVID-19 patients. Well, today, Texas has plenty of hospital capacity. We have a solid supply chain of PPE, and many of our doctors and nurses have patients who desperately need medical treatment. It is time to allow those doctors and nurses to return to work. However, it must be done in ways to ensure that we will be able to treat COVID-19 patients. Adequate supplies of hospital beds and PPE must be maintained to ensure that all COVID-19 needs are met. So, effective April the 22nd, which obviously is next week, current restrictions on surgery will be loosened. This will allow doctors to diagnose and treat more medical conditions without needing to get an exception. Just one example of this would be a diagnostic test for suspected cancer. Now, while loosening restrictions for doctors, we are enhancing standards to protect our vulnerable seniors who live in nursing homes and assisted living centers. To protect against COVID-19 getting into those living centers, we are requiring infection control policies, and we are minimizing the movement of staff between those facilities. Next is my executive order about the retail sector in Texas. Retailers are such an important part of our economy. They provide you with products that you need and want, and they create so many jobs. During our battle with COVID-19 over the past month and a half, we've seen some retailers sell products without customers going into stores, and hence reducing exposure to the coronavirus. You simply order the product and you pick it up or have it delivered to you. Because we've seen that this model works while also containing COVID-19, we believe that all stores in Texas should be able to operate retail to go beginning next Friday, 1 week from today. This temporary plan allows you to be able to access more retailers while also minimizing contact with others. It also sets standards on retailers that ensure safe practices intended to reduce exposure to COVID-19. To learn what those standards are, go to dshs.texas.gov/coronavirus. Next, your physical and mental health are important, especially at times like these. Going to parks is an effective way to address those needs. So, state parks will be reopened beginning this coming Monday. Now, in order to reduce possible transmission of COVID-19 in state parks, visitors must wear face coverings or masks. Also, visitors must maintain a distance of at least 6 feet from people who are not members of the same household. And for now, visitors cannot gather in groups larger than 5. Today's executive order also addresses schools. The team of doctors advising us have determined that it would be unsafe to allow students to gather in schools for the foreseeable future. As a result, school classrooms are closed for the remainder of the 2019-2020 school year. That includes all public, private, and higher education institutions. Now, teachers will be allowed in the classroom for video instruction if they choose, or to perform administrative duties, or to clean out their classrooms. For public education, TEA Commissioner Mike Morath will soon provide more details about how to proceed, and he will explore how to conduct graduation ceremonies. For higher education, Commissioner Harrison Keller will provide similar advice to colleges and universities about how to conclude programs this semester and how to operate semesters this coming summer. Next steps. On Monday, April the 27th, we will announce additional ways to open Texas. In these next 10 days, we will prepare a phased-in strategy to open Texas in a safe way. It will require comprehensive testing and assurances of hospital readiness for COVID-19 patients. It will focus on containing the risk of resurgence of COVID-19 and protecting our most vulnerable Texans. On April the 27th, revised plans will be announced. The new plans will be based on how well contained COVID-19 is in the state of Texas. The plans will consider standards to protect our vulnerable residents while allowing others to increase their interactions. They will outline which practices are safe for employers to use. They will consider the possibility of opening more venues like restaurants, movie theaters, and other gathering places that can provide safe distancing practices. They will also consider expanding elective surgeries. We will consider, in fact, all strategies that may open up Texas while also keeping us protected from the expansion of COVID-19. Let me close with this. Texans are battling a colossal challenge, an invisible enemy that has tested our lives and tested our livelihoods. Part of the Texas brand, however, is our ability to overcome challenges. We've overcome far more challenges than we can possibly count. Together, we can bend the curve. Together, we can overcome this pandemic. We can get folks back to work. We can adopt safe strategies that prevent the spread of COVID-19. And step by step, we will open Texas.